ആർക്ക് വേണേലും അൺമ്യൂട്ട് ചെയ്ത് സംസാരിക്കാം എന്നാണ് ഞാൻ മനസ്സിലാക്കുന്നത്.
ജോയിച്ചിന്റെ പ്രസന്റേഷൻ ഒന്ന് ഓഫ് ചെയ്യാൻ പറ്റും?
ഞാൻ പ്രസന്റേഷൻ ഞാൻ ഷെയർ ചെയ്യുന്നില്ലല്ലോ.
പ്രസന്റേഷൻ ഒന്ന് ഓഫ് ചെയ്യാമോ?
ഞാൻ പ്രസന്റേഷൻ ഓൺ ആക്കിയിട്ടില്ലല്ലോ അച്ഛാ. ഷിബിൻ ഉണ്ടോ അവിടെ? ഷിബിൻ.
No, Johnson Joseph is presenting.
അച്ഛനാണ്, ജോൺസൺ അച്ഛനാണ്. ജോൺസൺ അച്ഛൻ ആണ് പ്രസന്റ് ചെയ്യുന്നത്. ജോൺസൺ അച്ഛൻ ഷെയറിംഗ് ദ സ്ക്രീൻ ആണ്. ഷിബിൻ ഉണ്ടോ അവിടെ? ഷിബിൻ.
ഉണ്ട് സാർ, ഉണ്ട്.
എന്താണ് അച്ഛൻ ഏതാണ്ട് ജോൺസൺ അച്ഛൻ എന്തോ ചോദിച്ചിരുന്നു.
സാറ് തൽക്കാലം ആ പ്രസന്റേഷൻ ഒന്ന് ഓഫ് ആക്കിയിടാവോ? സാറിന്റെ പ്രസന്റേഷൻ.
എന്റെ പ്രസന്റേഷൻ ഞാൻ ഒന്നും ചെയ്തിട്ടില്ലല്ലോ.
ഓക്കെ, എന്നാ ശരി ശരി, ഓക്കെ, താങ്ക് യു.
ഞാനൊന്നും ചെയ്തിട്ടില്ല. ഇപ്പോൾ ജോൺസൺ അച്ഛൻ ഈസ് പ്രസന്റിങ്. വെൽക്കം ടു ഫസ്റ്റ് സ്ലൈഡ് വന്നിരിക്കുന്നു. ഇപ്പോഴാണ് സ്ലൈഡ് മോഡിലേക്ക് വന്നത്.
ഓക്കെ സാർ, ഓക്കെ ഓക്കെ, താങ്ക് യു.
നമ്മൾ ഇന്ത്യൻ ടൈം 2:41 PM ആയി. നമ്മൾ 2:45 തുടങ്ങുമല്ലേ?
Yeah, we begin at 2:45 p.m.
Okay.
Indian time.
ഹലോ ഞാൻ വീഡിയോ ഒന്ന് ഓൺ ചെയ്ത് നോക്കട്ടെ.
It's good. It's good.
Hello, good afternoon all. Thank you for being with us for today's webinar. A very warm welcome to one and all to the international webinar on cognitive behavior therapy, hosted by Department of Psychology, Psychology Alumni Association and IPSC of Kuriakose Elias College, Mananam. Kuriakose Elias College, affiliated to Mahatma Gandhi University, Kerala, was established in the year 1964. The college is named after our heavenly patron, Saint Kuriakose Elias Chavra, co-founder of CMI Congregation, is our source of inspiration. Saint Chavara is a great educationalist and social reformer of the 19th century in Kerala. It is often said that the motto of a college describes its aim. Our motto, Tamsoma Jyotirgamaya, means from darkness lead me to light. The aim of Kuriakose Elias College to develop our students into beautiful human beings could bring light into the world and make the positive changes that it needs. The holistic development of a KE student is attained through academic excellence, professional competence, personal, interpersonal, and societal skills. Let's move on to Department of Psychology, Kuriakose Elias College. The founding father of Department of Psychology, Reverend Father Sebastian Chamatara, in 1970 introduced psychology as a complementary paper for pre-degree course. In 1993, BA Psychology was introduced. In 2013, upgraded to postgraduate department. In 2015, self-financing UG Department of Psychology started. I would like to warmly invite our respected head of the Department of Psychology, Father Johnson Joseph, for the welcome address.
Namaskaram. I am delighted to welcome everyone to this international webinar on cognitive behavior therapy. Quoting the eminent French psychology philosopher and metaphysician René Descartes, cogito ergo sum means I think, therefore I exist. I comment CBT is always a philosophy of human survival and always significant. This webinar will be certainly a fruitful one as it can help us to think positively. I enter into the duty entrusted to me. First of all, I welcome Dr. Bridget Paul, the respected principal of KE College, who is a well-known academician and scholar. A lot of webinars taken place every day in KE College. In the midst of all the busy schedules, she is always there to support and inspire us. Dear ma'am, on behalf of the committee, I welcome you to this webinar.
Thank you, Father.
Reverend Dr. Xavier Z.S. is a man with dynamism and administrative skill. He is always there to lead and guide all the movements and academic endeavors on and off the campus. As the vice principal of the college, he is there to support us always. Dear Father Xavier, I welcome you to this international webinar session. With a great joy and happiness, I welcome Dr. Martin Tiselli, the IPC coordinator of the college. He has been always a great support to organize and conduct any programs here. We welcome you, dear sir. I extend a very hearty welcome to Dr. Joseph Matthew, our firstborn child of the department, who is an eminent alumnus, clinical psychologist, and CBT practitioner in Australia. Psychology Alumni Association Mananam is always a great support as well as energy source of the department. Joseph Matthew, who is called as Joichin, is our very good friend and a supporter. He is there whenever we request him a help because he is a unique blend of emotion and reason. On behalf of the webinar participants, I extend a hearty welcome, dear Joichin.
Thank you, sir. Thank you.
We extend our hearty welcome to all the professors, academicians, clinicians, research scholars, and our alumni members, and our dear students to this webinar. Thank you.
Thank you, Father. I would like to pleasantly invite our esteemed principal, Dr. Bridget Paul, for the inaugural address.
Good afternoon, all. Respected resource person of the day, psychologist Joseph Matthew, Vice Principal Reverend Dr. Xavier C.S., Head of the Department of Psychology, Reverend Father Johnson Joseph, IQSC Coordinator of the College, Dr. Matthew Stitelli, members of PAM, conveners of this webinar, Ms. Jesslyn Maria and Ashna Maria, faculty members and dear participants. Every human being becomes successful in life when he or she actualizes one's dreams. For achieving this, the individual needs to be in a state of well-being. He or she should be able to cope up with the normal stresses of life, work productivity, and contribute positively to the community. But in today's fast and competitive world, people face many problems like anxiety, stress, phobia, depression, grief, etc. It is in this context that the services of a clinical psychologist becomes inevitable. As Demi Lovato said, you don't have to struggle in silence. People can very well take the service of a seasoned psychologist. They play a very important role in improving the quality of life. I'm extremely proud to say that Psychology Department of K College is one of the best departments of the college in terms of innovative activities and programs on a regular basis. Today, on the very day of the association inauguration itself, they are smart enough to organize an international webinar. Alumni Association of Psychology Department, PAM, is also very active. I'm extremely proud that today's resource person, Mr. Joseph Matthew, whom all of us lovingly call Joychen, is an alumnus of the department belonging to the very first batch. Welcome home, Joychen. Very happy to see you again. In fact, I had attended one of your sessions earlier. I'm sure that all the participants of this webinar will be truly enlightened by your presentation on CBT. I once again congratulate the HOD, faculty members, and students for their continuous effort in making the college proud. With these words, I conclude and hereby declare the International Webinar on Cognitive Behavior Therapy as inaugurated. Thank you.
Thank you, ma'am. I graciously invite our respected Vice Principal, Reverend Dr. C.S. Xavier, to deliver the felicitation address.
Thank you so much, Jasmine. One good afternoon from my talk. Respected Principal, Dr. Bridget Paul, Head of the Department of Psychology, Father Johnson, Ms. Nitu, Ms. Jasmine, and all the faculty there, and all those who are attending this webinar. Once again, I wish you all a very good afternoon. I take this opportunity to congratulate the Department of Psychology, College Manana, for organizing such a wonderful webinar on their association navigating the arts of physical medicine. I really congratulate and thank you for your help. As we all know, cognitive behavioral therapy is considered to be one of the most effective ways to treat mental health issues around the globe. Whether it is due to the everyday stress of human life, or the traumas or the global healthcare crisis due to the COVID-19 pandemic, anxiety and depression have emerged as major concerns for people all over the world in recent times. Even before the pandemic hit, mental health issues were a cause of concern in our day-to-day life. According to the recent survey of International Mental Health Society, nearly 50% of Indians were active intervention in cognitive behavioral. And I believe that cognitive behavioral therapy is considered to be one of the most effective ways to mental health issues across the world. And for those who might not know all about CBT, initial study is known as CBT, cognitive therapy. Now it is cognitive behavioral therapy. And the CBT is a type of talk therapy which helps us to manage our problems by figuring out ways to change our behavior and the cause behind it. But with social distancing and the extended or continuing lockdown, it can be difficult to provide therapy in the international or in the traditional face-to-face manner. Which in turn has caused for greater possibility to develop electronic behavioral activity or known as EBD. But EBD is just as effective as traditional communication approach. I don't believe so. But I hope Dr. Martin, the resource person, will definitely help us to take place for this more. So I once again congratulate the Department of Psychology for selecting and I cordially welcome our resource person, Dr. Matthew, to his Atma Martha once again. So also congratulate Psychiatrist Dr. Martin and our narcotic counselor for organizing and for giving their efforts and giving their to have this webinar in a good manner. So once again, I wish you all and I wish you all success by this way. I thank you. Thank you and God bless you for not be a friend. Thank you so much.
Thank you, Father. I pleasantly invite our IKC coordinator, Dr. Matthew Stitterly, for the felicitation address.
Respected Principal Dr. Bridget Paul, respected Vice Principal Father Dr. Xavier CS, today's resource person and our alumnus Joseph Matthew sir, the vibrant HOD of the Psychology Department Dr. Johnson Father, Jeffrey Miss, Ginger Miss, and all the participants. Once again, hearty welcome to all to the KE College. First of all, congratulate Psychology Department, especially Psychology Department and Ginger Miss and all the organizers for conducting such a webinar on cognitive behavioral therapy. This webinar is very much helpful in this pandemic period because this pandemic disease may affect the people and they get disturbed or they have some destructive minds. In order to overtake this, in order to change their mind negative to positive, this webinar may help. So I wish, as the IOC partner of the college, all the very best to all the participants who are attending this webinar. Thank you again.
Thank you, sir. Now I would like to invite Psychology Alumni Association Executive Member Mr. Sunny Joseph, clinical psychologist in Bangalore, to deliver the felicitation address. I'm sorry, Mr. Sunny Joseph was not able to join, so I'm continuing. For those of you just joining us, welcome all of you to the webinar. Before moving on to the presentation, I would like to remind the participants that if you have any issues or concerns during the webinar, please type them into the chat box. We will have question and answer session after the presentation of speaker. We will share the link to the feedback form in the chat box at the end of the presentation. Kindly fill out the feedback form to receive your e-certificate. Thank you. Let me introduce our resource person of today's webinar, Mr. Joseph Matthew. It is a great pleasure for me to introduce our special guest and alumnus, Mr. Joseph Matthew. From our first batch, 1993 to 1996, Joseph Matthew is a clinical psychologist and a trained CBT practitioner in Australia for the last 12 years. He is a member of Australian Psychological Society and a member and supervisor of College Clinical Psychologists. He has done MPhil Clinical Psychology from Kastuba Medical College, Manipal. He started his career as clinical psychologist at Mental Health Center, Thrissur, Kerala, and later joined health service and worked at General Hospital, Ernakulam. Further pursued his career as senior clinical psychologist at Goulburn Valley Health, Australia, and in full-time practice for 12 years. He currently continues to focus on supervising students, training, and private practice. Over to Mr. Joseph Matthew for the webinar presentation on cognitive behavior therapy.
All right. Thank you very much, and I will try to put my slide up. Sharing. Can anyone see my first slide?
Yes.
Right. Yeah. Thank you very much. Thank you very much, Bridget Miss, Sevarachan. Thank you very much for your good words. Johnson Acha, Jesselyn Miss, Chinju Miss, all the faculties, K College. Thank you for giving me an opportunity to present. വീട്ടിൽ വരിക എന്നുള്ളത് എപ്പോഴും ഒരു സന്തോഷമുള്ള ഒരു കാര്യമാണ്. അപ്പോൾ ഈ ഒരു ഫാമിലി മീറ്റിങ്ങിൽ ജോയിൻ ചെയ്യുക എന്നുള്ളത് വളരെ സന്തോഷമുള്ള കാര്യമാണ്. എൻ്റെ ഗുരുനാഥന്മാരായ ചാമത്രയച്ചനെയും മാത്യു സാർ, രാധിക മിസ്, അവരായിരുന്നു എൻ്റെ ടീച്ചേഴ്സ് 93 മുതൽ 96 വരെ. അവരുടെ ഒരു ഗൈഡൻസ്, അവരുടെ ഒരു മെന്റോറിങ് ആയിരുന്നു എൻ്റെ ഒരു ജീവിതത്തിൻ്റെ ഒരു മേജർ മൈൽ സ്റ്റോൺസ് എന്ന് പറയാനായിട്ട് ഞാൻ ഈ ഒരു സാഹചര്യം ഉപയോഗിക്കുകയാണ്. ഇന്നത്തെ എൻ്റെ ഒരു പ്രസന്റേഷനിലേക്ക് പോവുകയാണെങ്കിൽ കോഗ്നിറ്റീവ് ബിഹേവിയർ തെറാപ്പി കുറിച്ചിട്ടാണ് ഞാനിന്ന് ഒരു 1 hour സെഷൻ, ഇന്നത്തെ എൻ്റെ ഒരു പ്രസന്റേഷൻ. CBTയെ കുറിച്ചിട്ട് അല്ല ഞാനിന്ന് ഇന്നത്തെ എൻ്റെ ഒരു പ്രസന്റേഷൻ. CBTയെ കുറിച്ചിട്ടുള്ള തിയറീസ് ജെസലിൻ മിസ് ഇന്ന് സംസാരിക്കുകയായിരുന്നു. എല്ലാവരും സ്റ്റുഡൻസ് ആണ്, മജോറിറ്റി ഓഫ് ദ സ്റ്റുഡൻസ് ആണ്. അപ്പൊ അതുകൊണ്ട് CBTയെ കുറിച്ചിട്ടുള്ള ഒരു തിയറി അല്ല ഇന്നെൻ്റെ ഫോക്കസ്. CBT സെഷനിൽ എന്ത് സംഭവിക്കുന്നു, എന്താണ് സംഭവിക്കുന്നത് എന്നുള്ള ഒരു ബ്രീഫ് ആയിട്ടുള്ള ഒരു ഐഡിയ പ്രസന്റ് ചെയ്യാനായിട്ടാണ് ഞാൻ ഇന്നത്തെ ഈ ഒരു മണിക്കൂർ ഉപയോഗിക്കുന്നത്. നിങ്ങൾക്ക് കൂടുതൽ സംശയങ്ങളുണ്ടെന്നുണ്ടെങ്കിൽ മിസ് പറഞ്ഞതുപോലെ നമുക്ക് ചോദ്യോത്തര വേദിയിൽ നമുക്കത് കൂടുതൽ സംസാരിക്കാം. അപ്പം വിൽ സ്റ്റാർട്ട്, വിൽ നോട്ട് മിസ് ദ ടൈം. ആദ്യത്തെ ഒരു 4-5 സ്ലൈഡ് CBTയെ കുറിച്ച് എന്തെങ്കിലും പറയണമല്ലോ എന്ന് വിചാരിച്ചിട്ട് ഞാനൊരു കുറച്ചൊരു സ്ലൈഡ്സ് പ്രസന്റ് ചെയ്തിട്ടുണ്ട്. നമുക്കറിയാം, കഴിഞ്ഞ ഒരു 50 വർഷമായിട്ട് CBT ഹാസ് ബിക്കം എ പെർമനന്റ് psychological interventions. Hello. Hello. Oh, okay. Thank you very much. Yeah. All right. So I got the notification that there are people who doesn't follow Malayalam. So I will continue shift my presentation into English. Thank you very much, Father Johnson, for notifying me. So over the last 4 or 5 decades, CBT has grown to be a very, very prominent psychological therapy. So there are large amount of evidences that CBT is very efficient So the theory of CBT is so simple to understand. We know that cognition leads to beliefs, leads to emotions. So it's easy to understand. But when it comes to learning CBT skills, it's very hard. It's very hard to learn it from books. The theory is understanding, but the skill is not easy to understand from books. So that's something that I'm briefly touching in this presentation. And when it comes to CBT, it's an umbrella term. We can anything that changes our cognition these days call us CBT. It is not the environmental trigger. That's a basic principles of CBT. It is not the environmental trigger or the situation that causes a person's emotional response, rather than it is what the person thinks about these events that leads to their emotional reaction. So that's a basic principle. It's not the situation, it's the way you look at the situation leads to the emotions. And the CBT is not a new idea. It has been there for centuries. If you read the philosophy, if you read the classical books and text in history, we see this notion in many writings. For example, I don't wait for moods. You accomplish nothing if you do that. The Pearl has said, if you think you can do a thing or you think you can't, then you are right. So Henry Ford. The ancestor of every action is a thought. So Ralph has mentioned. Shakespeare has said that there is nothing good or bad, but thinking makes it so. Even in centuries, first century writings, we have read the same thing. People are disturbed not by things, but the view they take them. And Buddha has said that we are what we think. And from Bible, for us, he thinketh in his heart, so is he. So what I was trying to say is that the thinking leads to emotion is not a new concept. It is there being centuries. And then it comes to early development of CBT. And those who are psychology students who have done psychology, they are very familiar with the classical conditioning theory, operant conditioning, and laboratory studies based on role-play. So I'm not going to go into the details, but you will be familiar, you will be aware of these theories. I'm just trying to say that this is where the origin of CBT is. And then comes back to the Ellis, Dr. Albert Ellis in 1950s. The cognitive influence in therapy as we see today started with Ellis. Ellis said that human beings are not particularly affected by external people and things, but by the view they take these things on. So again, that's where this historical information that is sitting there is taking some form of therapeutic shape. In his rational therapy, so he named it rational therapy first, he proposed that the therapist should work with their disturbed clients in two ways: by challenging their self-defeating propaganda and superstitions, and then encouraging the clients to take part in some type of activity which acts against the nonsense that they believe. I always say this example to explain this side. See, when I came into Australia, my first interview for my job, I attended it, and I was wearing a blue shirt. And then that thought that came to my mind that that blue shirt is a lucky shirt. So every time I do something important, I tend to wear that blue shirt again. So I engaged, I believed myself. I developed a superstition in my mind that this blue brings luck. So every time I go somewhere, I tend to wear it. So the so at this stage, it's not distressing me. It's not a problem for me. But the problem came much later, when the shirt started wearing off, and then I couldn't wear it because it was that bad. And then my anxiety started kicking in. And then I became panic, and I was not confident in things that I was not doing without that shirt. And this is where I'm saying the challenging part, the role of the therapist here is to challenge the thoughts and encouraging the client to wear a blue shirt or a green shirt when he attends a very important meeting next. So this is what this slide means. Challenging their thoughts and encouraging the clients to take part in some type of activity which acts against the nonsense. So the nonsense is that blue shirt brings the luck. So what should I do? I throw all my blue shirts away, and I had to put it in the bin, and I had to wear a blue shirt. Oh, sorry, I had to wear a red shirt for my next interview. And then I had to wear it repeatedly until that I was comfortable with other colors. So that's what Elise was talking about. Elise renamed rational therapy into rational emotive therapy later, stressing the importance of thoughts. And Elise renamed rational emotive therapy in 1993 into rational emotive behavioral therapy, acknowledging the importance of behavioral techniques. So the behavior part of this came much later. And then there's another person came into at the same time, who is Aaron Beck, developed his theory cognitive therapy of depression around the same time. Beck proposed that affective disturbances in depression was secondary to cognitive distortions with themselves of self-esteem, self-blame, overwhelming responsibilities, and desire to escape. So Beck was proposing the same concept around the same time where Elise was presenting the same. The combined term cognitive behavioral therapy came with Mitchambam, who coined the term cognitive behavioral modification. So this is what they were presenting. So when activating events leads to beliefs, which turns causes to the consequences, as Albert Ellis, whereas Beck proposed situations, thoughts, and feelings. So they were talking about the same thing. They were talking about the same thing in different words. And interestingly, they were just 200 kilometers away and working on the same theory at the same time, and they didn't know each other. So that was a bit surprise. Beck developed cognitive therapy from the empirical. Yeah, this is what they are saying is, what I'm trying to say is, Beck was working in a clinic, whereas Ellis was a philosopher. He was doing teachings. So that was the basic difference. And there are a few qualities or values that CBT recommends: self-interest, social interest, self-direction, high frustration tolerance, flexibility, acceptance of uncertainty, commitment to a reactive pursuit, scientific thoughts, self-acceptance, risk-taking, long-term hedonism, non-utopianism, responsibility for one's own emotional disturbances. I'm just not giving you, yeah, I'm going to the next slide. And this is one of the major criticisms, it was one of the major criticisms of CBT. What the criticism was that the CBT doesn't give importance to therapeutic relationships in the sessions. That was the early stand of Beck and Ellis. They gave importance to the technique, they didn't give too much importance to the therapeutic relationship in the session. But we know now that it is the CBT gives importance to therapeutic relationships, and that's a science. Science progress from truth to the better truth, and from better truth to best truth. So that's a progress. So we know now that therapeutic relationship is important. Early CBT theorists on techniques of therapy reference to therapeutic relationship. This is one of the major criticism, but we now know that the therapeutic relationship is important, much important. And specific factors influence the therapeutic relationships. Acknowledgement, indicating active listening, supportive communications, reassurance, praise and sympathy, direct guidance, directive and structuring, encouragement, giving positive feedback, positive labeling, the active and directive approach, high level of empathy and unconditional positive regard, asking questions, offering structure, provide information and advice, being confident and persuasive, being sensitive to clients' readiness to change. So what I'm trying to say is that therapeutic relationship in the session is important, but it has changed. It has changed from the base in the last 50 years. CBT has changed a lot. So that's what we give importance to the relationships. There is a difference in medical model and CBT, whereas medical model is more inductive, whereas CBT is hypothetical deductive. Number of different professionals. I'm just reading out just layman differences. CBT involves one profession, categorical, whereas focused on behavioral complexity. Inductive medical model is static, whereas CBT is dynamic. Information sort may not be seems relevant, whereas focus on problem of relevance to the client. Focus on diagnosis, whereas CBT focuses on behavioral goals. Treatment is specific to diagnosis, but it is based on the conceptualizations. Initial assessment, basic ID, behavior, affect, sensations. I will be explaining this details in the coming sessions. Interpersonal interactions and pattern of relationships and drug. Yeah. The structure of the CBT sessions, we know that this is what the structure is. General view of the last week session. Check how the client is feeling today. Review the homework task. Work on the agendas. Summarizing significant points. Summarizing what we learned and checking upon the clients. I will be focusing today on these 6 steps. So before going into the CBT, what is happening in the session, I just wanted to just get some feedbacks about how you are going. Can you hear me? You can understand me? I know that there are lots of questions that will arise, but that is for the question answer sessions. But just a feedback, Miss, can you give me some feedbacks about? Is it audible, Johnson? Jesselyn, Miss, can you give me a little bit of, or anyone?
Yes, it's audible.
So it's okay.
Yes.
Can I go ahead with the next part?
Yes, sure.
Thank you. So today this is what is happening in the session, and this is what I'm going to present a little bit in details. So CBT has got 10 steps, and I will be focusing more on that first 6 steps, and then we will briefly go into the 6, 7, and 8 and sessions, and then we will go for the question answer sessions. Okay, we'll go for the first. So this is what how identifying the activating event or a situation. That's the most important one of the first steps in CBT is asking a client why you are here and what brought you here, or what is the problem that you wanted to discuss, or simply asking what do you want to discuss, or yeah. So that's asking the question. An activating event is an anything that we can react to. Can be an event. It can be behavior of self or others. Event means an accident. Event can be a breakup. Event can be anything. A behavior of self or others. Behavior of a friend. Behavior of a teacher. Behavior of a neighbor. Thoughts. It can be a thoughts itself. Can be an activating event. The thoughts that I'm not good enough, that itself can create emotion. So it's not an event or behavior of self or others. A thought itself can trigger emotions or the feelings. How come my feelings become a situation? A person who continues to feel depressed, that can create more thoughts and emotions to it. So can be anything. So a person who comes to the clinic by saying, I feel depressed all the time. So activating event can be event, behavior of self or others, thoughts or feelings. So it is important, part of the therapy is to choose the correct activating event. Second, identifying the emotion, identifying the feelings. The question is, how do you feel about it? So we will just get an example from here. It's the corona. Say, COVID is a situation now, or there is COVID everywhere. So that if that is a situation, that's a situation. So identifying the emotion is, how do you feel about it? How do you feel about having coronavirus everywhere? I feel anxious. So the clients needs to be encouraged to allow themselves to explore their emotions. It can be anxiety with this particular situation. Everybody is feeling anxious. That's why we are all sitting inside and listening. Otherwise, you would have been out. So we all feel anxious. Sometimes it can be depression. Sometimes it can be guilt. The emotions can be sadness, frustrations, anger, annoyance. It can be frightened, concern, fear. So the role of the therapist is to assist the clients to identify their emotions. So, so the question that can be asked is, how do you feel about the situation? So I assume that everybody is feeling anxious, so everybody can connect to that anxiety. So the emotion is anxiety, and then exploring the consequences or the feelings, and we need to examine, we need to measure the severity of this anxiety. So we often use a 10-point scale, asking the subjects, asking the clients to indicate their level of emotion on a 10-point scale. For example, if you're anxious, and if you rate your anxiety on a 10-point scale, so 10 means maximum anxious, and 0 means not anxious at all, where would you put your anxiety about having coronavirus around? So subjective unit of distress by Joseph Wolpe, that's how it is. On a 10-point scale, how you can ask if it is depression, pain, how severe it is on a 10-point scale. So that's the first step, assessing, putting it on a number. Then asking the clients what behavior they engage in when they have a particular emotions. So what do you do? What do you do when you are feeling anxious? So you said that you are anxious, and you said that, say for example, 8 out of 10. What do you do? What do you do when you feel anxious? doing is, in this particular anxiety situation, it can be avoiding, running away from, or stay at home. An angry person behavior would be yelling, screaming, throwing things, or drinking, using drugs, smoking. So what do they do? What do they do when they feel anxious? And asking the physical sensations. So that's next, asking the client what physical sensations accompany their emotions. The physical sensations of anxiety, for example, would be heart beating fast, maybe shaky, sweaty, sick in stomach, butterflies, headache, dry mouth. So what do you feel when in your body when you feel anxious? Or if it is sadness, people may be feeling heavy, or people maybe feel tight in their muscles. So it's important to know the physical sensations. If it is anger, then it may be again something similar to the anxiety, which is autonomous physical sensations would be increased, like heart beating fast, or tightness, or shaky. So exploring the consequences is the third step in CBT. Why it is important to assess these emotions, why you have to put it onto a number, why you have to assess the behavior, and why you have to assess the emotional, the physical reactions to it. One is, all the emotions do not require therapy. So for example, if a client says that my next neighbor has got corona, and how do you feel about it? I feel anxious. And if the person says, and if person says that if the person rates the anxiety as 3 out of 10, we know that's a normal emotion that doesn't require any therapy. So it's important to assess. It is important to assess. And there are some cultural issues. All the cultural differences may be there. Some people may present their physical sensations differently, or some people say in certain cultures, they may not see. They may say that I remember a client saying the person is presenting with a depression, but the person was saying that there's all. Where do you feel? What do you feel in your body? Was my question, and the person was saying that it's all dark in my chest. So that's a cultural differences. Some people may not be able to accurately put it into the exact symptoms. So it's important that we need to assess the physical sensations and behavior, and the accuracy. Some people may come up saying that they are feeling sad, or they are feeling upset. And when we go into the physical sensations, we may say that they are presenting with symptoms of anxiety, heart beating fast, and things. Or the other way, they may be saying anxious, and these physical sensations are not consistent with anxiety. They are consistent with the depression. They may feel heaviness in chest. They may see tightness. So to know the accuracy, it's important that we measure it. And then at the end of the session, we get if you ask the client at the end of, say, 10, 15, 16 sessions, when we end the session, when we ask, where do you rate your anxiety now on a 10-point scale? So we know that the person rated 8 before, and if the person says 5 or 3, then we know that, okay, so end of the session, we know the progress. So it's important that we need to evaluate the feelings. And it's an important concept, evaluating the presence of secondary emotion. Secondary emotion is the metacognition. I'm assuming that I'm not going fast. Let me say I don't have any feedbacks, but that's okay. If you have any questions, yeah, you can talk about it later. So this is an important part of CBT, secondary emotion, evaluating the presence of secondary emotion. It is the feelings about the feelings. Ask the client, how do you feel about being anxious? So a person is coming to us and saying, I'm feeling anxious. So we have assessed the emotion, we have identified the emotion, we have rated the emotion, we have made the physical sensations correct, and we have made the behavior associated with it. And now the question is, how do you feel about being anxious? It is important. We can't miss this point, because if the secondary emotion is severe, then we need to go with the secondary emotion first. I will explain in coming session. So there is something that many people miss here, and they don't get it correctly, the importance of presence of secondary emotion. Secondary emotions are frequently more severe. So if it is more severe, then we need to address the secondary emotions first. I'll give you an example of secondary emotion. Say somebody death of a loved one. So that will be the situation. And missing. I'm missing her. I'm missing her. She's not here. He's not here. So that's a thought. And the sadness is the emotion. Okay. And after some times, the sadness becomes the situation. And they're saying that I should not be feeling sad. I should not be. I should be overcome by now. I should not continue to feel sad like this. So that leads to depression. So I just saw a client the other day, exactly the same. Person lost his father. Father was 83 something, and he expected that the father is going to die, and he died. And he had this emotion, the grief coming back, and then he thought that he is going to overcome his grief in 2 weeks' time. So he took 2 weeks off, but he was having this uncontrolled emotion, burst out into tears, and then he broke down in workplace. And everybody said, his boss said that go home and take rest, and then have another week off. Hereafter, the person started thinking, no, I should be strong. I should not burst into tears before everyone. So the person started thinking that I'm weak. I'm not strong enough as I thought. So the person started developing some form of depression out of it. So this is where we need to address the depression first, not the grief. So I hope you understand. Or the other example is, the situation here is husband act in an unacceptable way. The thoughts is that he should not treat me like that. And then anger. Okay, that's a normal emotion. And the anger becomes the situation that I should not be getting angry. And I should not be feeling angry. I should not be feeling this way. And you develop either more anger or you develop more anxiety. That's something that I come across with. I get angry about things kids do, and I may react and overreact, and I start thinking, oh, I'm a psychologist, I'm a clinical psychologist, and I have all this experience, and I should not be yelling at, I should not be screaming like that, or I should not be feeling angry. And because I feel angry, I'm not a good psychologist. I'm not a good person. Or see, this is how a secondary emotion kicks in and makes our life uncomfortable and miserable. Hope you understand. And then comes to the fifth stage, which is eliciting the beliefs. At this stage, so we know what the emotion is. So you know what the situation is, and we know what feelings is, and we know where it sits, and we know the physical sensations, we know what we do, what the client does, and we know the secondary emotion. And some people may have difficulty in eliciting the emotion. So we can use visual imagery. Use of visual imagery can be used in case of avoidance when a client is not able to verbalize. So imagine that you are in a supermarket and then you can say that how anxious you are, something like that. So so going back to the next, eliciting the beliefs has got three levels, or in other words, thoughts has got three levels. One is the automatic thoughts. You can use you may see different terminologies used there: inferences or automatic thoughts. So the immediate thoughts or the automatic thoughts, the inferences is the first thought that comes to your mind. You feel anxious because, so that's a question the therapist will be asking. So you feel anxious because there's a corona going on everywhere. What are the other thoughts that comes to your mind? Or my immediate neighbor has got this virus. What are the other thoughts that comes to your mind? Okay, I have heard that this is a respiratory condition, and if I get, I may die. Even if I survive, I heard that there will be lasting consequences. So you feel anxious. So these are the automatic thoughts that comes to our mind. So this is what we are eliciting from the therapist point of view. You need to elicit all the immediate thoughts that comes to your mind about that particular situation. Then goes into the demands, eliciting the demands or rule. So if the client says that that I may get corona, I may get COVID, I may get this virus. So what do you think? What do you expect? What do you think should happen? So that's a demand. We are asking, we are eliciting what this person expect. The expectation is that I should not get this virus. I should be healthy. I should not be, I should not get this health. I should be healthy. I should not get it. If I get it, I should overcome. I should be healthy. I should continue to live longer. So these are the expectations that person is holding, and we know only by eliciting the automatic thoughts and the eliciting the evaluation or the core beliefs. What does that means to you? Okay, so this is what is that means to you is that it's a core beliefs, eliciting the core beliefs. So I may get corona. So that's inferences or automatic thoughts. I should not get corona. So that's a demand or rules. And what does that means to you if you get it? If you get corona, what does that means to you? It's unfair. So the evaluations can be very often be directed to self, directed to others, or directed to external force. So, and all these three levels of thoughts has got importance when it comes to challenging or in therapy. So it is important. Or we take another example to make it more clearer what that core beliefs means. Coming back to that person who was talking about his father's death, I should not be feeling sad. So that's the demand. I should be overcoming by now. But you are not overcoming. So what does that means? If I'm not overcoming, I'm weak. I'm strong. I'm not strong, or I'm not good enough, or I'm worthless. I'm useless. So this is what I'm talking about, the evaluations of core beliefs. So if you will see that if you have worked in with the clients, you will see that in depressive clients, the evaluations would be about self, like I'm not good enough, I'm worthless, I'm useless. If it is the anger, the evaluation would be about the other person, the person outside. They don't care, he doesn't listen, he doesn't love me. Whereas in anxiety, most of the time, it is about external force, or like I'm not in control, I'm not coping, or it's unfair. So this is important in 3 levels of thoughts. Eliciting these 3 levels of thoughts are very important in CBT. So yeah, you'll have more automatic thought in a social anxiety situation. Other people will think that I am strange. So the demands or rules, here there is a change in the word, because Beck uses automatic thoughts, assumptions, and evaluations. So according to Beck, the initial thought that comes to a person's mind is automatic thoughts. This is an example of a social anxiety person. People will think bad of me, or that I'm strange. The rule is that the demand is that other people should not think that I am strange. Other people should approve me. Other people should not think bad of me. They should not judge me. The core evaluation is that if they don't approve me, I'm not good. If they think bad of me, I am bad. If they think that I'm not good enough, I'm not good enough. So this is the assumptions according to the Beck. Whereas Ellis use inferences. Other people think that I am strange, and he uses the term demands. Other people should not think that I am strange. Other people should approve me. Evaluation is the word that Ellis use. If they don't think I am not good enough, I am helpless, I am worthless. So just put it to make the difference. So, and after having these informations, now it is about telling the clients that it's not the situation. That's the purpose. That's the theory. That's what we are saying. It is not the situation that is making you feel anxious. It's not the COVID crisis. It's not that your neighbor got coronavirus is making you feel anxious. It is the way you think about the situation that is making you feel anxious. So that's what CBT is saying, that it is not the situation. It is the way you look at it. It is not people in supermarkets making you feel anxious. It is the way you think about the situation is making you feel anxious. And then there are 3-4 approaches that we often use. One is intrapersonal direct approach, and what if it were me approach. So we'll just briefly discuss about what that approach is. Direct approach is telling the client, it's a psychoeducation way of telling, it is a counseling approach. It's telling that, can you see that it is not the situation, it's making you feel anxious. So it's a direct educational approach. Once you have elicited the thoughts, beliefs, and feelings, you point out to the client that it is their thinking and not the situation that causes how they feel. Example, have you ever thought that it may not be the people in supermarket that makes you feel anxious, but you are thinking that other people think that I am strange, that makes you feel anxious. So that's a direct approach. Intrapersonal approach is something that I often use, which I found to be most effective. The therapist compare times when the client might have felt differently about the particular event, and then helps them to see what it's through the thoughts leading to the different feelings. Coming back to that corona case situation. So your neighbor has got a diagnosis, or he is positive. Okay. So how long he is being, when did he get this result? 2 days ago. Okay. So in the last 2 days, did you feel anxious all the time? This is a question that I'm asking. So did you feel anxious all the time in the last 2 days? The client would be saying, not all the time, because there were times I was watching TV. There were times I was talking to people over the phone. There were times I was eating. There was time I was doing things. So what were your feelings at that time when you are reading, or when you are watching TV, or when you are talking? Normal, okay, happy. So at that time, when you're feeling happy, what were your thoughts about this, your neighbor getting corona or you getting corona? I was not thinking about it. So this is where the therapist compares times when the client might have felt differently about the particular same situation. So when it comes to the supermarket situation, do you always feel anxious when you're in supermarket? No. What do you feel on other occasions? You feel normal, or maybe less anxious, or maybe getting busy, picking things, items. So what goes in your head when you are normal? Okay. And at that time, what were your thoughts about the other people looking at you? And then people would say, no, I was not thinking about it. So comes to the conclusion that it is not the situation, it's not the person making you feel anxious, it's the way you think about this person is making you feel anxious. So I think you got it clear. Interpersonal approach. The interpersonal approach. Interpersonal approaching is, it involves asking the client if they believe everyone in the same way feels the same. If there were other 3 people in the supermarkets, or go back to the corona crisis, do all your family members, what about your dad, or what about your mom, or what about your sister, do they feel anxious the way you feel anxious? No, my mom seems okay, she's working, or my dad, he doesn't care, my sister, she is okay. What would be their feelings? They are okay, they are feeling happy, or they are feeling normal. So what would be their thoughts about getting corona? They may not be thinking, they may be thinking something else. So is it the situation? If it is the situation that's making someone anxious, the situation should make everybody feeling anxious. No, your family members do not feel the way you feel. So is it your thoughts that is making you feel anxious? So that's how the question goes. Or if it is the supermarket situation, if there are 3 people in the supermarkets, do you think that all feel the same way? No. So how do the first person feel? He may think, I have to go back to work, or I have to do something particular. So how do you think they would be feeling, or how would be the third person be feeling? So that's the interpersonal approach. And this is another way of, if number 1, 2, and 3 doesn't work, it should work. But if it doesn't work, you can ask, it is putting the psychologist or the therapist into the other situation and saying, if I was living in your house, or if a corona client living next my door, do you think that I would be feeling? The person may be saying, you're a psychologist, you know better, so you may not be feeling anxious at all. Something like that. Okay. So, and then once this is being done, so this is where we have all the informations, and now it's ready for challenging. At this stage, the client understands that their thoughts leads to their feelings. Therapist goes on exploring the client's beliefs, reevaluate them, challenge them, and the next slide is about there are different types of challenging strategies. It's a didactic, Socratic, there are metaphor used and humor used, so different types. But the challenging can be done in, there are three main challenging techniques. Empirical dispute. Empirical dispute is we are asking the evidences. Logical dispute is we are trying to find the logic behind these thoughts. And pragmatic dispute is where we are challenging by asking the helpfulness or unhelpfulness of these thoughts. So I'm not going into the next slides, and I think it's time to go to the questions. I may be able to clarify a few things about the challenging, but challenging was not my, and it may be another presentation sometimes later. So I'm just coming back to the main screen, and I'm just stopping the presentation here, and it's about times and time for question and answers.
Thank you, Mr. Joseph. Now it's a time for questions. I kindly request the participants to type your questions in the chat box.
Or maybe, yeah, if they want to
Okay,
type,
the first
or
question
there's
is
another
from Mr. Sony GP. Sir, is it effective with all the clients? Whether CBT is effective with all the clients?
Okay. No, CBT is when we choose a client, we look for, especially when it comes to, say, depression. There are we look for some patterns. If there are clinical depression, if there are biological symptoms, if there are cyclical patterns, there are organic things, then we may not directly go into. In other words, if there is very strong family history of mental illness, a strong family of history of suicide, there is very strong family history of mental illness and very severe episodes in the past, then the symptoms are so severe, then we may not take the clients for CBT immediately. So in that way, CBT may not be effective. And there are certain diagnoses like chronic complex PTSD symptoms. So we may use other forms of psychotherapeutic technique. So we wouldn't, CBT is not a solution for all the mental health issues, but definitely for depression, anxiety, and anger, any emotions, definitely adjustment disorder, anxiety, depression, any kind of phobias, any kind of depression without a strong family history of mental illness, suicide. But we will take the clients for CBT if it is combined with other supports like medications and things.
Okay, thank you. Next question. How to get specialized in CBT? Is there a specific certification needed for CBT?
Question is from India, right?
Yes.
All the training institutes have CBT as their teaching in their syllabus. But as I said in the beginning, CBT is easy to understand from theory. It's easy to understand the theory. It's easy to understand from books, but the skills that we therapeutic skills, as we see in there, I would say that there is no certification courses. There's no certification courses that I am aware of, but there are CBT training skills happening by many prominent clinical psychologists. But there is no CBT institute, or there is no CBT training center in India. But in other Western countries, Beck Institute runs the CBT training. Ellis Institute runs the CBT training. So they have internship programs. In Australia, where I got my training, my supervisors, I have two supervisors. Both of them are directly from, one is Ellis direct student, and my other supervisor is Beck student. So they run an institute called CBT Australia. So I got trained from them. But no, there is no such training centers in India. But some of you know that I have done trainings in India, and something similar to what they do in Ellis Institute. Otherwise, university is the main source of learning CBT now.
Okay, thank you. Next question from Ashwati. How many sessions on an average will be needed for a client to start using on the techniques on their own in the future when these thoughts occur?
Usually, the first session is about knowing the client. As we know, it's an knowing the client, understanding the client. So first session will be an assessment, and then the second session is about this making the BC connection. So that's what I was presenting. So the 6 steps. So that's I do in the second session, and then there are 10, 12 sessions of challenging. Depends on the severity, but if I have an anxiety client, or if I have a person coming with an adjustment disorder, 10 sessions, 12 sessions. But if the cases are complex, it may go up to 18 sessions. So maximum 18 or maybe 22 if the cases are complex.
Okay. Next question from Kirtana. Does CBT works in patients with schizophrenia?
Good question. Yes, it works, but not the way CBT wouldn't treat the symptoms of schizophrenia, but it will help the clients to understand that it is their symptoms. So the symptoms of, say, schizophrenia would be hearing voices, or they may have delusional thoughts, or they may have other symptoms of psychosis. So CBT is not helpful in reducing the symptoms of the psychosis, but it will help to reduce the distress that is coming from the symptoms. So at the end of the CBT, would be they will be able to say that it's my symptom. It's okay to have the symptoms, and so the distress is coming from the way they look at the symptoms of schizophrenia. So CBT in psychosis is a big area. The CBT is used in psychosis to reduce the distress, to reduce the distress coming from the symptoms of schizophrenia.
Okay. Next question from Veena. What if the client is not ready to accept the advice given by the counselor?
Okay. If the client is not accepting the advice, we are not giving the advice. CBT is helping the clients that it is not helping you. So that's what pragmatic disputation is. Coming back to that, the situation that we were talking about, the COVID crisis or the social anxiety. So the question is then, how is it going to help you by holding on to these thoughts? What is these thoughts doing to your life? Is it helping you to achieve your goal in life? No. Is it helping you in your relationship with other people around you? Your thoughts and the feelings? No. And you thinking about it, you worrying about it, is it going to stop the corona run away from your neighborhood? No. So what way is going to help you physically or mentally? So the person, I'm sure that the person's answer will be no. So that's the answer for them. It's not helping you. So what's the purpose of is it worth making your life miserable about something that you don't have any control over? So it's not helping you. So is it worth holding on to it? So yeah, if they don't accept it, we can't do anything about it. But the goal of CBT is to develop that insight and help them to develop that insight and challenge their thoughts.
Next question is, while eliciting beliefs, what if the person thinks he's not good enough, not because of others, but by their own thoughts and beliefs?
Yeah, the automatic thoughts, I'm not good enough, is not something that a person just born with. I'm not good enough is a core belief that person has acquired over the period of years from their life experience. So it may start from childhood. I'm not always necessarily saying that it should start from childhood. It may be from school, or it may be when they grow older, or when they're at workplace. So every time something goes wrong, the thoughts keeps coming that, oh, he's doing it, he should not be doing it. So the feeble mind wants to find an answer. That's another thing. We can't settle with, our brain has got a nature. You can't settle with uncertainties. We always wanted to find an answer. And when we find an answer, mind settles. But this is where the person concludes that I'm not good enough, I am helpless. It's not coming from a particular incident that day. So it's a formulation. That's why it is called core beliefs. It's called evaluation of self for a long time. So we need to identify the core beliefs. Then only we'll be able to challenge. You'll be able to challenge the thoughts. And without challenging these levels of thoughts, 3 levels of thought, person may feel good for sometimes, but I don't think there will be any structural changes that's going to take place. So it is important to elicit these thoughts. Only through thoughts we can elicit the demands and core beliefs. Hope I answered the question.
Okay, thank you, sir. Next question. Sir, can you tell us when CBT become a challenging one?
Yeah, there are people who have resistance. There are people who are so strong and very, very strong in their formulations. So sometimes it's too hard, and sometimes it's being challenging. So they build up the resistance, they build up the defense, and I often come across with challenging people, but if they are willing to work on, they will continue. But if they are not willing to work on, they will drop out. So in that way, I have people who quit the sessions in between because sometimes it becomes too hard for them. And that is when the CBT therapists have different approaches. People go for soft. They may not be able to. They may not be challenging them directly from the very beginning, and then they take a soft approach. They take a psychotherapeutic approach. Sorry, they take a supportive approach first, and gradually challenge their thoughts. But yeah, it is challenging. Every CBT session for me is challenging, and I can give you a number of evidences that people walk out from the session and then come back later saying that I went and had a good thoughts about it, and they come back and work on there. Yeah.
Okay, next question. There are some who are possessed with certain belief systems which would be too difficult to be disputed. What to be done in such a situation?
Yeah, is it helping you? If it is not, if it is not helping you, then what is the purpose? What is the purpose, or what is it helping? In what way is going to help you? So that's where the pragmatic disputation is helping you, asking the question: in what way you holding on to these beliefs help you in any way? So that's a pragmatic disputation is something that I often use when they're not ready to challenge. But there are people who just drop us. I said it will be too hard for them to challenge because it's too ingredient, or maybe other complex. They may have other complex issues in their life. So that is when we as a psychologist, we know that this person may need more than CBT. So either we change the approach or we refer the clients to appropriate other psychologists who may work with other strategies.
Dear participants, the time given for the question answers is over. So we will take one last question. Many people say that the consulting psychologist should not try to be a friend or develop friendship with the client. Then how should we communicate with them? This is our last question.
You're talking about, you're asking about the therapeutic relationship in the session. We are friends. We are as the psychologist, or we are working as an emotional coach. We are using when clients are too distressed, when they are, we human beings disintegrate into pieces. We just disintegrate into pieces at times of crisis. We plan things, we put things in place and forward, and then something happens suddenly. Who will not be disintegrating, who will not be becoming irrational. So at times of crisis, depends on different people have different crises at different times. For some it can be illness in the family, for some it can be kids issue, for some it can be job crisis, for some it can be for some it can be a cockroach in the corner of the room, or you see a snake in front of you. You will be standing, jumping on the couch, on the court next day. So that disintegration is normal as human beings, because we have a brain that disintegrates like that. But do we stay there all day on that cot or couch and scream? No. You look around. I know that that snake is not coming to attack me, it's going to the other side. Or you come to know that it's not a poisonous snake. I know that even if it bites me, I'm not going to die. Or you come to know that the hospital is next to me. So we use our IQ, we use our logic, we use our we logically analyze the situation, and the client in front of us are in that similar crisis. They are not able to use their logic, they are not able to use their IQ and analyze the situation at that time. So we psychologists are helping them to analyze the situation, and we are friends. We are considering the client as normal human beings, and we are friends. We can have an approach, we can have a teaching approach, we can have a friendly approach, we can have a it's up to you, it's up to your personality as well. And depends, your personality also comes into play a significant role there when you're dealing with the client. So we are friends, we can approach, And going back to that question again, do I develop a friendships with the client later? No, I wouldn't develop a real. I have friends who comes to me for psychological help. Definitely, I will help them and will remain the contact. But I am working in a town where and I see them. I see them every day in supermarkets. I see them every day in hockey, and when I drop my kid for tennis lesson, I see them, and their kids play with my kids. And we will be sitting. I will be sitting in my car and waiting for him to come out. And when I see him in the road or when I see him in the park, we say hi, we say we talk, and we generally have a conversations. So why not? Why not be a friend? Why do you just cut the ties with the human beings just because he happened to be in a crisis one stage in his life, and you happen to be the psychologist in his life? So yeah, friendships are okay, but we don't develop a close emotional contact with the client in any way. No.
Okay, thank you. There are a lot of questions which have not been answered due to lack of time. We will email these questions to the resource person and will get back to you at the earliest. Thank you all for your active participation in this webinar. Now, I would like to invite Ms. Ashna Maria Paul, Faculty, Self-Financing Department of Psychology, to propose the vote of thanks.
Namaste. I hope I am audible.
Yes, Ashna. Go ahead.
Okay, thank you. A pleasant afternoon to one and all. One candle lights another and can light thousands of other candles. So one heart illuminates another heart and can illuminate thousands of other hearts. A beautiful quote by Leo Tolstoy. This is what happening exactly in every classroom. The teacher illuminates one heart. Through that, the whole society is get illuminated. Due to the extreme situation of this pandemic, we were compelled to shut down our classrooms. But now, with the help of technologies, we are recreating those classrooms in another platform. Today, we all are present in such a classroom and we get illuminated in heart. Gratitude is the most exquisite form of courtesy. I'm here to deliver the gratitude to you all who made this program a big success. First of all, the resource person of today's webinar, psychologist Joseph Matthew, clinical psychologist and CBT practitioner, Australia, and the beloved alumni of Department of Psychology, KE College. He's a well-known psychologist and a very renowned CBT practitioner. We are really honored to have such a personality as our alumni. On behalf of KE College and also the Department of Psychology and all the ones who are present here, I thank you, sir. As an alumni of Psycho Family, we have the freedom to address him as our elder brother. Thank you, Joycha. Thank you so much. For the very first time, we were planning this program. Our respected principal, Dr. Bridget Paul ma'am, was with us. She was giving full support for us in all means. I thank you, ma'am. Our vice principal, Father Dr. Xavier CMI, is an enthusiastic person with high energy. He always used to share that energy with us. Thank you, Father, for your guidance and support. As we all know, this webinar is in collaboration of both IQAC of the college and Alumni Association, PALM. So I express my gratitude to the IQAC coordinator of KE College, Dr. Matthew Stitherly. Thank you, sir. PALM, Psychology Alumni Association, Mananam. The most special gift we have, a very strong and a very passionate alumni. In this occasion, I would like to thank Dr. Sunny Joseph, the executive member of PALM. Thank you, Sunnicha. The most important person behind all the programs of psychology department is our HOD, our blessing Father Johnson Joseph CST. I take this opportunity to express our deep gratitude to Father Johnson. Thank you, Father. Along with that, the faculty members of our department, HOD of Self-Financing Department, Ms. Ambali Robin, Webinar Coordinator, Ms. Jasil Maria Maman, Ms. Chinchu Rani Vincent, Ms. Kartika Elizabeth, and Ms. Sajna Sajan. I thank you all for your immense support. The technical support for this program was given by Mr. Shibin Simon from IQAC Wing. Thank you, Shibin. Finally, you all, the participants of this webinar. I hope this was a very fruitful session for you, and I thank you all for attending this webinar. I would like to conclude by quoting Martin Luther King. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But by all means, keep moving. By all means, we, the Department of Psychology, KE College Mananam, is moving forward. I welcome you all for the upcoming events of our department too. Thank you. Thank you so much. Have a great day.
Thank you, Ashna. Participants, kindly note, we have posted the link for feedback form in the chat box. Once again, thanks to all the participants for joining us today for the webinar. It's been my pleasure to host this event, and I wish you all a pleasant evening. Thank you.
Okay, Joychan.
Okay.
അവിടെ ഓസ്ട്രേലിയയിൽ രാത്രിയായോ?
ഇവിടെ 8:30 രാത്രിയില് 8:30. ഞാനിന്ന് ജോലിയിൽ രാവിലെ മുതൽ ഇങ്ങനെ തന്നെ ഇരിക്കുകയായിരുന്നു.
അപ്പം ഇവിടെ പാർട്ടിസിപ്പൻസ് ഇപ്പോൾ ഇവിടെ ഇനിയും ആൾക്കാരുണ്ട്. അപ്പം എല്ലാവർക്കും ഒരിക്കൽ കൂടി നന്ദി. പ്രത്യേകിച്ച് ഈ ഒരു പ്രോഗ്രാമിന് പിന്നിൽ പ്രവർത്തിച്ച പ്രോഗ്രാം കോർഡിനേറ്റേഴ്സ് ഉണ്ട്, ജസ്റ്റിൻ, മിസ് രാഷ്ന. അവർ രണ്ടുപേരും ഞാൻ ഏറെ ഹൃദ്യമായിട്ട് അനുമോദിക്കുന്നു. ഒരു 700ഓളം പാർട്ടിസിപ്പൻസ് ഉണ്ടായിരുന്ന ഒരു പ്രോഗ്രാമായിരുന്നു ഇത്. മിക്കവർക്കും ഇതിൽ ജോയിൻ ചെയ്യാൻ സാധിച്ചില്ല. അപ്പം ഏറെ സ്നേഹത്തോടെ ഡിപ്പാർട്ട്മെൻറ്റിൻ്റെ പേരിൽ പ്രത്യേകിച്ച് ജസ്റ്റിൻ മിസ്സിനും അഷ്നയ്ക്കും അതുപോലെ IQCയിലെ ഷിബിൻ, IQC സെക്രട്ടറി ഷിബിനും ഏറെ ഹൃദ്യമായിട്ട് നന്ദി പറയുന്നു. അതുപോലെ പാം ഇനിയും മുമ്പിലേക്ക് ഒത്തിരിയേറെ പ്രോഗ്രാമുകൾ നമ്മൾക്ക് ഒരുമിച്ച് ചെയ്യേണ്ടതുണ്ട്. അപ്പം പാമിൻ്റെ എക്സിക്യൂട്ടീവ്സിന് എല്ലാവരെയും ഏറെ നന്ദിയോടെ ഓർക്കുകയാണ്. താങ്ക് യു.